Women in North Carolina can now go to the pharmacy and get birth control without a prescription. It went into effect on February 1st and allows qualified pharmacists to provide certain contraceptives after the patient completes an assessment. The patient must be 18 years or older. Dr. April Miller is an assistant professor of obstetrics and gynecology with Atrium Health Wake Forest Baptist. She says that questionnaire includes things like your height, weight, blood pressure, as well as information about your menstrual period and medical history. Dr. Miller explains the benefits of this new law.
There are many more pharmacies in the state than physicians' offices. I think this will greatly increase access and hopefully help women plan pregnancies.
But this only allows pharmacists to give out the pill and patches. Dr. Miller says birth control like IUDs and implants are the most effective with the lowest pregnancy rates.
I still think it's best for a patient to seek medical care from a physician or advanced practice practitioner, such as a nurse practitioner or nurse midwife. However, again, if access is an issue, being able to go to your local pharmacy is a really great option.
It's important to note birth control has other benefits, including helping with period regulation, decreasing acne and cyst formation, according to Dr. Miller. Now, under this law, pharmacists will also be able to prescribe prenatal vitamins, HIV medications, and nicotine replacement therapy. Our sister station did speak with the North Carolina Board of Pharmacy. The executive director said they are still waiting for final protocols in place by the State Department of Health and Human Services before those services can get underway at pharmacies. But he says he expects it to happen soon. So a lot in there, but the main thing is this is going to increase access to birth control for a lot of women. Another interesting point that I wanted to point out was that this is going to be great for people that are in between insurance companies or maybe jobs, or maybe they're moving and they just haven't gotten, a new prescription yet. They can always go and pick it up at the pharmacy.
That's pretty neat. I didn't think about that aspect when she was talking about that access to birth control. I was thinking about the long-term effects, like the foster care system and things of that nature, and limiting those unwanted pregnancies, because a lot of people don't have access to birth control. Then they get pregnant, and there might be certain people that aren't in a situation to care for a child.
Yeah.
So
guaranteed. Well, there's going to be a lot on this, right? I can see, because I'm completely on the fence. Exactly what you said, I agree with. The access to birth control for people that want to use adults and that type of thing. My fear is that will there be fewer teenage pregnancies? Are you saying that, premarital sex is okay? There's going to be people that go with this on both sides and run with
this. You have to be 18.
Okay, good.
So
I did not hear that.
You can, if you are a minor, you can go to a doctor's office, a physician, and they can prescribe you a contraceptive without parental consent. However, that does not mean that you can go to a pharmacy. You have to go to a physical doctor's office.
So the 18-year, okay, good, because I did not get that.
Yes.
And then that brings up something else, and we could talk about another time. But when my kids turned 16, they had to sign to allow me to have access to their medical records now. That's a new thing that I thought, wait, I'm the parent. How can I not? You have to sign a form like the HIPAA laws to be able to have access.
that is another conversation.
Anyway, that's part of this,
worth
part of the whole thing.
Absolutely. It also makes me think about, I just lost my train of
thought.
thought.
Yeah, that's okay. Welcome to my world.
What I was going to say was something like this. I think the big part about this is going to be getting that message out there and letting people know that this is here. And we've seen it work in other states before, so it has been successful.
Right, yeah, we are definitely not the first state to do this.